Okay. So let's talk about the other reason for nephrotic syndrome. The most common reason for nephrotic syndrome is diabetic glomerulosclerosis. Fine, guys. Diabetic. So in diabetic, so when a patient is diabetic, what happens to the kidney? Two important pathology happens. First, initially there will be hyperfiltration first. Fine. So why is there hyperfiltration? What is basically the pathology in diabetic? There will be excess of glucose, isn't it? That glucose will be filtered by the glomeruli into the urine. So along with the glucose, it will also be pulling the water into the urine. So therefore there will be initially hyperfiltration. But after a while, it will result in non-enzymatic glycosylation of the basement membrane. So what does this mean? Those glucose which are entering into the urine, they need to come in contact with the basement membrane, right? After that only it has to come in the urine. So during that process, it will undergo, that glucose has the capacity to cause non-enzymatic glycosylation of this basement membrane, which is not good, because basement membrane, we know it is what is responsible for the charge and size barrier, right? To protect all the solutes and all from entering into the urine. That is what is responsible for the basement membrane. When there is non-enzymatic glycosylation of the basement membrane, which is caused by this glucose, then we will be having, then in such case, the patient will be more progressing to the renal failure. So this is what generally happens in diabetic. Fine. So before we go into further details, we should know about some more causes, some more nomenclature. So there is something known as diabetic glomerulosclerosis. This is commonly used. So you should know what it means. As the name says, in diabetic, the glomeruli is undergoing sclerosis. Why? Because of the non-enzymatic glycosylation of the basement membrane, the basement membrane becomes thickened and it becomes sclerosed. So that is seen in diabetic. Therefore, it is called as diabetic glomerulosclerosis. Another thing is, here it undergoes hyaline arteriosclerosis. So what do you know about arteriosclerosis? The hyaline is a protein which gets deposited in the arterioles, that is the afferent as well as efferent arterioles, resulting in a sclerosis. That is known as the hyaline arteriosclerosis. Sclerosis is just imagine like a thickening which is happening in these arterioles because of the hyaline which is getting deposited directly in the arteriole. And the other term which you need to know is Kimmel-Steen-Wilson nodules. So what are the Kimmel-Steen-Wilson nodules? As the name says, what is a nodule? The nodule should be something which is looking like this, isn't it? Something like a nodule, isn't it? So this nodule is that the glomeruli is being thickened, the basement membrane is being thickened, therefore it is forming this thick nodule, and inside it there is this pink deposition of hyaline. So this is what forms the Kimmel-Steen-Wilson nodules. When the hyaline gets deposited inside the glomeruli, and each glomeruli, when it becomes thickened, it forms Kimmel-Steen-Wilson nodules. And the same hyaline, when it gets deposited in the arterioles, then it is known as hyaline arteriosclerosis. Then a glomerulosclerosis is, as the name says, it's quite obvious, right? Now let's go on to the other details. So generally, what kind of drug is given to patients suffering from diabetic? So the drugs that we give are ACE inhibitors as well as ARBs, isn't it? So what do? We know that ACE inhibitors and ARBs, they will prevent the constriction of the efferent arteriole. So once the efferent arteriole has been constricted, the pressure is high in the glomeruli. When the pressure is high, the filtration will be more, isn't it? So how does this get connected? See, when do we call a patient as renal failure? When the filtration is not proper. Let me explain it to you much more simply. Say for example, you are filtering a tea, or you have a coffee machine which is filtering the coffee. So in that case, when the filter is more, that means the kidney is good. When the filter is less, that means the kidney is failing. Fine? So that's what you should remember it like that. So the drugs like ACE inhibitors and ARBs, what do? they actually decrease it will not allow the efferent arterioles to constrict. If the efferent arterioles are not constricted, then the pressure within the glomeruli is decreased. Am I clear? So now when the pressure is decreased, the filter is also going to decrease, right? As I had told already, when the filter is decreased, that means it's going to renal failure. Now you might wonder, why should we give a drug to decrease the filter? You are right. Now we still give this is the right one only, because since the efferent arteriole is not constricted, it is dilated, the glucose is not filtered out of the glomeruli and it doesn't reach the basement membrane. The glucose still stays within the arterioles. So since the glucose doesn't stays within the arteriole and doesn't reach the basement membrane, the non-enzymatic glycosylation of the basement membrane doesn't happen. So we are protecting the basement membrane in a long term. So even though we stop the hyperfiltration which is happening as a first phase, we are preventing this non-enzymatic glycosylation of the basement membrane by giving the drugs like ACE inhibitors and ARBs. This is an important concept which you need to understand, and this will be tested frequently in USMLE. Thank you for listening. Have a good day.